What is the diagnostic criteria is? We have one major criteria, that is it's positive blood cultures. Second one is evidence of endocardial involvement. Now how will we define this major criteria? What is defined as a positive blood culture? So if typical microorganism for infective endocarditis is isolated from two separate blood cultures. Now what are the typical organisms? One is Streptococcus viridans, another is Streptococcus galolyticus, Hayseck group, and Streptococcus staph aureus, or community acquired enterococci in the absence of any primary focus. So Streptococcus viridans, Streptococcus galolyticus, Hayseck group, staph aureus, or community acquired enterococcus. Or patient has, so there has to be these two separate blood cultures, one and one. They should grow, these typical organisms. Or patient should have persistently positive blood cultures defined as recovery of a microorganism consistent with infective endocarditis. So you recover a microorganism that's consistent with infective endocarditis from blood cultures drawn greater than 12 hours apart, or all three or a majority of greater or equal to 4 separate blood cultures with first and last drawn at least 1 hour apart. So you are going to recover a microorganism that's consistently associated with infective endocarditis, and there should be persistently positive blood culture. Those blood cultures should be drawn greater than 12 hours apart, or there has to be all of three or a majority of greater or equal to 4 separate blood cultures with first and last drawn at least 1 hour apart, or single blood culture positive for Coxiella burnetii, or phase 1 IgG antibody titer of greater is of 1:800. Phase 1 IgG antibody titer of greater than 1:800. What's evidence of endocardial involvement? Patients has to have a positive echocardiogram or new valvular regurgitation. So we define it: patient has oscillating intracardiac mass on valves or beat supporting structures, or in the path of the regurgitant jets, or in the implantable material. In the absence of an alternative anatomic explanation, a patient should have abscess or new partial dehiscence of prosthetic valve or new valvular regurgitation. Increase or change in pre-existing murmur is not, we have to remember, it's not sufficient. So positive echocardiogram is patient should have an oscillating intracardiac mass on a valve or on the supporting structure, or in the path of the regurgitant jets, or an implantable material, in the absence of an alternative anatomic explanation. Or patient should have an abscess or new partial dehiscence of prosthetic valve or a new valvular regurgitation. Note that increase or change in the murmur, pre-existing murmur, is not sufficient. What is the and minor criteria? There is predisposition. That means predisposing heart conditions or injection drug use is there, or fever greater than 38 or 100.4 is there, and vascular phenomena, immunological phenomena, you see vascular phenomena, arterial emboli, septic pulmonary infarcts, myocardial aneurysms, intracranial hemorrhages, conjunctival hemorrhages, Janeway lesions, and immunological phenomena, glomerulonephritis, ossular node stenosis, spots or rheumatoid factor, glomerulonephritis, ossular nodes, Roth spots and rheumatoid factor is seen. So a patient has, for example, rheumatoid factor comes out to be positive, and you see that patient has fever 100.4 degree Fahrenheit, and patient has this intracranial hemorrhage or conjunctival hemorrhage. Yes, so fever, conjunctival hemorrhage, and rheumatoid factor is coming positive. So three minor criteria have been fulfilled. Now one major is to be fulfilled. Patient will be considered as a case of definite infective endocarditis. But we mostly see this fever and conjunctival hemorrhages very often. So always send rheumatoid factor, because this will come in the possible diagnosis of infective endocarditis. Microbiological evidence is positive blood culture but not meeting major criterion as noted previously. So major criteria that has been defined previously, it is not met, or there is serological evidence of active infection with an organism that is consistent with infective endocarditis. So definite endocarditis is defined by documentation of two major criteria of one major and three minor or five